Ciclopirox. Uses, benefits, and how it works. What is Ciclopirox? Ciclopirox is an antifungal medication used to treat a wide range of fungal skin and nail infections. It's available in several forms including cream, gel, shampoo, suspension, and topical solution. Each formulation of Ciclopirox is designed to target specific conditions effectively. This medication is applied directly to the affected area, with frequency depending on the type of infection and the form prescribed, typically from twice daily to twice weekly. For most skin infections, noticeable improvement may occur within 1 to 4 weeks. However, treating nail infections often requires consistent use for 6 months or longer to achieve visible results. What is Ciclopirox used for? Healthcare providers commonly prescribe Ciclopirox for the treatment of jockage, athlete's foot, ringworm, tinea versicolor, a fungal infection causing discolored skin patches, yeast infections of the skin, seborrheic dermatitis of the scalp, treated with Ciclopirox shampoo or gel, fungal nail infections, treated with Ciclopirox nail lacquer. How does Ciclopirox work? Ciclopirox belongs to a class of antifungal agents that stop the growth of fungi. It works by disrupting the fungal cell's ability to absorb essential nutrients, preventing the fungus from surviving or reproducing. Over time, this helps clear the infection and restore healthy skin or nails. Side effects of Ciclopirox. Like most medications, Ciclopirox may cause some side effects. Many of these are mild and temporary, often improving as your body adjusts to treatment. However, it's important to contact your healthcare provider if symptoms persist or worsen over time. Common side effects. Mild skin redness occurs in up to 46% of users, especially with the nail lacquer. Temporary burning or stinging, reported by up to 34% of users, most common with the gel formulation. Itching or irritation at the application site. Other possible side effects. Dry skin or flaking. Rash or acne-like eruptions. Changes to nail shape or color, seen with the nail lacquer. Hair discoloration, associated with the shampoo formulation. If you experience severe irritation, swelling, blistering, or signs of an allergic reaction, stop using Ciclopirox and seek medical attention right away. Ciclopirox dosage forms and average cost. Ciclopirox is available in several topical forms, each designed for specific conditions. Cream, gel, and suspension, typically prescribed for skin fungal infections. Shampoo, used for scalp conditions like seborrheic dermatitis. Nail lacquer, formulated to treat fungal infections of the nails. The average cost for one 6.6 ml bottle of 8% Ciclopirox nail lacquer is around $23.35 with a GoodRx coupon, which is approximately 73% off the retail price of $87.47. For Ciclopirox shampoo, a 120 ml bottle of 1% concentration costs about $29.12 per bottle. Typical dosing instructions for Ciclopirox. Cream, gel, and suspension. Apply a thin layer to the affected area and the surrounding skin twice daily, once in the morning and once in the evening. Gently massage it in until absorbed. Shampoo. Wet the hair and apply about 5 to 10 milliliters of Ciclopirox shampoo to the scalp. Massage thoroughly and leave it on for 3 minutes before rinsing well. Use twice weekly, allowing at least 3 days between applications, for a total of 4 weeks unless otherwise directed by your provider. Nail lacquer. Apply Ciclopirox nail lacquer once daily at bedtime using the provided applicator brush. Each new layer should be applied over the previous one. Once a week, remove the accumulated layers with rubbing alcohol before starting a new cycle. Consistency is key for effective results. Nail infections can take several months of daily use to clear completely. Pharmacist tips for using Ciclopirox safely and effectively. 1. Avoid contact with sensitive areas. Ciclopirox should never be applied to your eyes, nose, mouth, or genital area. If Ciclopirox shampoo accidentally gets into your eyes, rinse them thoroughly with water right away. 2. Complete the full course of treatment. Always use Ciclopirox for the entire duration prescribed by your healthcare provider, even if your symptoms start to improve. Stopping treatment too early can cause the fungal infection to return. 3. Apply to clean, dry skin. Before applying Ciclopirox cream, gel, or suspension, wash and completely dry the affected area. Always wash your hands with soap and water after application to prevent spreading the infection. 4. Avoid nail products during treatment. If you're using Ciclopirox nail lacquer for a fungal nail infection, avoid applying nail polish or other cosmetic nail products. These can block the medication from working effectively. 5. Don't cover the treated area. Avoid using dressings, bandages, or wraps over the treated area unless specifically instructed by your healthcare provider. Covering the skin may interfere with how the medication is absorbed. 6. Foot care for athlete's foot. When using Ciclopirox to treat athlete's foot, wear shoes that fit properly and allow for airflow. Change your socks and shoes daily to keep your feet clean and dry. This helps speed up recovery and prevents reinfection. 7. Skin color changes with tinea versicolor. If you're using Ciclopirox for tinea versicolor, the fungal infection may clear within a few weeks. However, it can take several weeks or even months for your skin color to return to normal. This doesn't mean the treatment failed. The fungus is gone, but your skin needs time to heal. 8. When to contact your provider. If your symptoms do not improve after 4 weeks of using Ciclopirox, inform your healthcare provider. You may need a different antifungal medication or further evaluation. 9. Pregnancy and breastfeeding. If you're pregnant, planning to become pregnant, or breastfeeding, let your provider know before using Ciclopirox. It's not yet known if this medication can affect your baby. Ciclopirox is a versatile antifungal medication that can effectively treat various skin and nail infections when used properly. Following these pharmacist tips helps you get the most benefit from your treatment while minimizing the risk of side effects or reinfection. Info, your all-in-one destination for trusted, science-backed health information. Subscribe now for more expert advice from pharmacists and healthcare professionals. Stay informed, stay healthy, and take control of your treatment with confidence.